mynews.studio.
Imagine this, a single bacterium, decades of blindness, and now a 94% drop in cases. Is it really possible that trachoma could be eliminated by 2030?
Today is February 15th, 2026. Trachoma used to threaten 1.5 billion people. Now, fewer than 100 million are affected. That's a 94% reduction in about 20 years. How did we make that kind of progress?
A lot of it comes down to the World Health Organization's SAFE strategy. That stands for surgery, antibiotics, facial cleanliness, and environmental improvements. But the real shift happened when countries started adapting these tools to their own settings. Take Fiji. They dug into their local data and combined community outreach with school health programs. That way, they tackled problems that were specific to the islands.
Right. And in the Americas, there wasn't a template they could just copy. They used rapid assessments and designed interventions specifically for remote rural communities. It really shows that community engagement isn't just a catchphrase, it's actually what changes outcomes.
Exactly. 27 countries have reached elimination status so far. Places like Egypt, Fiji, Burundi. That's in line with the WHO's goal of 66 countries by 2030. But what's holding the rest back?
The main obstacles are the persistent hotspots, Ethiopia, for example, and some isolated parts of the Americas. These places still struggle with limited access, sanitation, and sometimes funding. Right now, there's a $300 million funding gap if we want to hit the 2030 target.
And there's the risk of trachoma coming back. Experts say it's crucial to make trachoma control part of primary health care, because if it stays a separate campaign, it's easy to lose momentum once the first targets are met.
There's also the effect of climate change. Changes in rainfall and migration patterns can shift where and how the disease spreads. So, is the answer to keep innovating, or should we just double down on what's already working?
Honestly, it's a bit of both. The explosion of new data has changed everything. Since 2012, teams have used smartphones for surveys, plus new blood tests. That means they can target interventions almost in real time, one exam every 25 seconds on average.
That's a huge amount of data, and it's actually being used. The Global Trachoma Mapping Project and Tropical Data have pinpointed where help is most needed. In 2024 alone, mass antibiotic campaigns reached over 44 million people, and more than 87,000 surgeries were done to fix trichiasis.
Partnerships have played a big role too. Organizations like WHO, CBM, PAHO, and the International Coalition for Trachoma Control all brought something different. And by focusing on high-risk groups, especially women and children in indigenous communities, interventions have been much more effective.
But there are still 97 million people at risk. So what's needed for the final stretch?
We need more community training, better integration with primary care, and most importantly, closing that funding gap. Strong leadership at the country level has gotten us this far, but the final stage is always the most difficult.
Daniel Ngamije at WHO says the 2030 goal is achievable if we keep up the pace. And it's not just about trachoma. This approach is becoming a model for other neglected tropical diseases. By the end of 2025, 58 countries had already eliminated at least one NTD.
Preventing blindness doesn't just save sight. It boosts economic productivity, improves education, and lifts the quality of life for some of the world's most vulnerable people.
So, as we head towards 2030, the real question isn't only about finishing the job. It's also about what lessons we'll take into future battles against preventable diseases.
From 1.5 billion people at risk to under 100 million, and now a blueprint for fighting other diseases. That's the legacy we're looking at.
Thanks for listening. Today's episode was brought to you by mynews.studio. You can try it now for free.